Well, Omicron is spreading in Israel. The country of over 9 million people has seen infection rates skyrocket in the past week, with Prime Minister Naftali Bennett warning that up to 4 million people could be infected. The fast-spreading variant has prompted worries that the government is no longer on top of the pandemic. DW's Tanya Kramer reports now from Tel Aviv.
The line is long for a free COVID-19 antigen test at this official center in Tel Aviv. With the Omicron variant spreading fast, free PCR tests are now reserved for people over 60 and other high-risk groups. Everybody else is required to take an antigen test first. With ever-changing rules, patience is running low.
Basically, the rules change on a daily basis. There's a joke that if you refresh the news page, then you get different restrictions and different rules.
It feels like a circus. If they cancel the PCR tests, then they should let us do the antigen testing at home and send our kids back to school. Now we have to stand here, can't work, and just have to stay at home.
Israel had made an early bet on its rapid vaccination campaign. In October, it had successfully slowed down the Delta wave by administering a third booster shot. But now the country struggles with the Omicron variant.
We're talking variant that is spreading very fast. The incubation period is about 2 days, not 7 days as used to be. So this is why many of the epidemiological measures, especially testing and breaking chain of transmission, are much less efficient right now.
Much of Israel's COVID strategy had been focused on vaccination. Over 4.3 million Israelis have taken the third booster shot, less than half of the population of roughly 9.4 million. Since last week, the country has begun to roll out the fourth boost for people over 60, medical staff, and other high-risk groups.
Okay. Each time we boost, we fortify our immune response, we deepen the immune memory, and enhance our ability to cope more efficiently with the variants that are already challenging us and those that will, and unfortunately, will emerge.
But it is still unclear how hospitals will cope during this fifth wave. At Ichilov Hospital in Tel Aviv, family doctor Laura Azuri takes us to the COVID-19 ward. Not every bed is occupied right now, but numbers of severely ill patients are increasing daily. A majority are unvaccinated or have underlying health conditions. At the moment, some of our patients are vaccinated, some are not. Everyone hospitalized has underlying health conditions, heart, kidney condition or diabetes. But again, the vaccinations are very important and very efficient. After so many waves of this disease, there's a sense of experienced routine on this ward. And now newly authorized drugs can be given to patients early on. Still, after 2 years, it's not just hard for doctors and nurses to keep up, but for everyone struggling with the new uncertainty that's replicating along with this latest variant.
And we can speak now with Professor Nadav Davidovich, whom we met in that report. He's the director of the School of Public Health at the Faculty of Health Sciences at Ben-Gurion University and also an advisor to the Israeli government. Thanks for being with us. Professor, how worried are you about the current spike of infections in Israel?
We are indeed in unprecedented times. Although the Omicron is probably less severe from a clinical perspective, the huge wave, the pace of transmission, and the combination of influenza that is very prevalent now in Israel as in other countries, including severe cases, all this create a huge pressure on the healthcare system. So we are going to face in the next few weeks very challenging times. We have overwhelmed healthcare workers that we need to take care of them. And the whole situation demand that we are going to answer with a multi-layer approach. Of course, we are vaccinating, but vaccination is going to influence only later those who are not vaccinated. So we need to have also an economic support and to support, of course, the healthcare system as well, including the burnout and the emotional aspects for those who are really under trauma after 2 years of a pandemic.
Now, Israel has started giving people their fourth COVID jab. You were talking about vaccinations there. Are vaccines enough to stop the current wave? And how effective is a second booster against the Omicron variant?
Vaccination are crucial, but not enough. We need to use wisely the testing system, for example, to see who are the high risk and use the drugs that are now available of Pfizer and Merck. We need to have the personal responsibility of people using masks, preventing large gatherings, and of course giving the economic support for those who are now under isolation. So the approach is health in all policies. We cannot just rely on vaccination. There are many, many other aspects, and we need to prioritize because the wave is so widespread. So it's mainly about those who are in high risk. There are special programs such as protecting those in home care facilities, of course, protecting healthcare workers and other emergency workers. This is the right approach because vaccination are important, but they cannot solve all the other different problems, especially now that we are in the middle of the crisis.
Now, Israel was seen as a leader in fighting COVID, especially at the beginning of the pandemic. Do you see it that way now?
There are many aspects that we indeed are world leaders. It's not just vaccination, it's the whole epidemiological picture because we have amazing health funds that are doing surveillance. So in terms of getting the epidemiological picture, in terms of testing per capita, we excel in, including also vaccination. There are other things that, unfortunately, I'm not so proud. The whole school system, we could be much more prepared, reducing number of children in class.
Okay.
So I think it's a very mixed picture, and I don't think there's any country that is perfect.
Okay.
What we're really doing very well is the community healthcare system that is preventing many hospitalization, and this is the main reason why death ratio is lower than most of the countries.
Okay, Professor, thank you very much. That was Professor Nadav Davidovich, Director of the School of Public Health at the Faculty of Health Sciences at Ben-Gurion University.